Yeah, good afternoon. So my topic of today presentation is about the compliance and follow-up. So we wanted to see what was the knowledge of glaucoma having in the patient population. This study was done in a South India population, and what was the percentage of follow-up also. So this was a prospective randomized controlled trial. So these are my financial disclosures. So the purpose of a study was to evaluate the impact of traditional counseling, which every one of us do. And then there was a patient-centric counseling in which a patient was given a separate room with one counselor, and we have some photos also and pictures also to make him or her understand. And then there was along with the patient-centered counseling, there was a third way in which we have given some audio reinforcement also, so as to explain about the disease process and all, and what if she doesn't do the follow-up. So what was the need of this study? See, we have had a lot of previous study which has actually highlighted the role of follow-up. In one of such a study was like follow-up is as important as the drug regimen. So keeping all this in mind, we have designed this study. And to our knowledge, there was no prospective studies been done which has addressed the glaucoma knowledge improvement and the retention of this knowledge to the patient. So with this RCT, we sought to determine the extent of the problem of the follow-up, then to evaluate the knowledge gains through these counseling, and to determine whether new counseling strategies and techniques may improve the longitudinal follow-up of glaucoma patient. So as I said, it was RCT. So we have had 399 patients from Arvind Hospital, Madurai. And these were our inclusion and exclusion criteria. Mostly we have taken the primary glaucoma patient and PX patient. So the study approval was taken from both Arvind Hospital as well as Stanford University Medical Center. And the declaration of Helsinki was taken into account. So all subjects were randomized to one of these three groups, like one is traditional counseling, one is patient-centric counseling, the third one is the patient-centric counseling with audio reinforcement. The demographic and clinical information of each patient was ascertained. So what we did first is all subjects completed the glaucoma knowledge assessment score, that is GCAS, before and after counseling session at the time of diagnosis and at 1 month follow-up period. So it was basically the GCAS was ascertained by giving a simple 8-question format of true and false. Very basic questions. I'll show you in the next slide what were those questions. And then patients were instructed to return to the clinic on follow-up 1, 3, 6, 9 and 12 months after enrollment. So the appropriate statistical tests were done to get our result. So our main outcome measures were glaucoma knowledgement assessment score, rate of appropriate clinical follow-up. We have defined the appropriate clinical follow-up as 3 out of 5 follow-ups. And there were some factors, if there is any factor which is independently associated with appropriate clinical follow-up. So these were our outcome measures. So we saw that only 13.5% subject had appropriate clinical follow-up. That is, out of 5, they completed at least 3 follow-up. There was no significant difference between all these 3 different counseling techniques. And GCAS, the glaucoma knowledge assessment score, was increased with the counseling, but after 1 month it has come down. So these were the follow-up. So some other factors were like, if the household income was less than 2,500 rupees, the follow-up were less, GCAS score more than 5, and undergoing any ocular surgeries, these patients had better follow-up. So these were our result. So in conclusion, all 3 counseling methods resulted in transient improvement of patient knowledge. Follow-up were bad in all those 3 groups. And there were some limitations also, like the counsel were of the same sets of counselors. So there was some blurring between those three techniques. And with this, we also wanted to evaluate some other studies also to assess some novel technique of glaucoma counseling so as to improve the follow-up and to increase the knowledge and to keep that knowledge into memory for glaucoma patient. Thank you.
Was there any family screening done or anything done towards that?
Madam, the proper demographic and family history was taken into account. Yes, ma'am.
Any other questions?
Muazzam, as I mentioned, counseling is very, very important in glaucoma. Not only for the disease knowledge, but also for the medications also.
Yes.
Because a proper counseling only will give you a proper compliance from the patient. If there's no counseling, compliance will be an issue. We have so many glaucoma patients. You also have been in Arvind. I'm also dealing in a charitable hospital. So if you have not given enough chair time, whatever medicines you prescribe, only that particular bottle is used by the patient, and then he comes for a follow-up after 3 months, and he'll say that you had only told to use this bottle, so I bought one bottle and that's it over. So proper counseling is important for a proper adherence, and counseling with the family members help us in creating awareness so that we can get other glaucoma patients, other patients who will come for glaucoma screening. The immediate family members plus the extended family. So counseling should be done with the patient and his family members in total. Very nice study, bro.